Got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's Money Transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
Cérémonie d'ouverture, et je voudrais à cette occasion demander à quelques personnalités de bien vouloir rejoindre le Présidium pour commencer les travaux. Je voudrais nommer M. Ousmane Baji, qui est le secrétaire exécutif du Conseil national de lutte contre le sida en Gambie, NAS. Nous avons M. Ahmed Djeganloum, qui est le directeur exécutif de NASO. Ngisali Turpin, directrice exécutive de ENDA Santé. Tania Martins, chef de la coopération de l'ambassade du Luxembourg au Sénégal. Et enfin, Toumata Diba, qui est l'assistante du directeur au niveau de Health Service, qui est directeur de Health Services. Mesdames et messieurs, bonjour. Nous vous transmettons également tous nos remerciements d'avoir bien voulu accepter de présider cette rencontre et de partager avec nous vos impressions et bien sûr vos orientations. Je vous remercie et je voudrais dans un premier temps donner la parole, laisser le micro à M. Ousmane Badji, qui est le directeur exécutif de NAS en Gambie. Monsieur,
Thank you very much, Michelle. Good afternoon, colleagues. The Assistant Director of Health Services, Dr. Fatoumata Diba, Mr. Jegan Loom from NASO. We also have Tenia, who is representing the Luxembourg Embassy in Dakar, and Gisaline from Enda Sante, who are the chief organizers as far as this particular regional steering committee on FEF project is concerned. Different experts in the room, including the UNAIDS country director and representatives from the National Human Rights Commission. We also have the program manager, National AIDS Control Program, from Guinea-Bissau, Senegal, Mali, Niger, and other countries who are part of this very important regional project on HIV and AIDS. Members of the media fraternity, our retired experts in the area of HIV and AIDS, Dr. Kabir Chan, Mr. Dauda Juve, Dr. Sabali, all other protocols duly and respectfully observed. It is my singular honor to invite and welcome all of you to this Regional Steering Committee meeting on the FEF project. For those of you who are for the first time interacting with us as far as the FAIF project is concerned, it is important to note that FAIF project is part of the UNAIDS 2021-2026 Global Strategy on HIV and AIDS. This is in recognition of the fact that governments cannot do it alone in the global response to HIV and AIDS. And so you needed to come up with some very innovative mechanisms that can help address the vulnerabilities relating to HIV and AIDS, particularly as it relates to cross-border and key population in the West and Central African region. We are grateful to have the support of the government of Luxembourg over the years, who have been very instrumental in keeping this particular platform very active over the years. We are holding this steering committee meeting in the Gambia for the first time. Usually it is a rotational event. And I am glad and I hope that the delegation from the different countries who are here have had an enjoyable stay since their date of arrival. We are hoping to also have an international panel after this formal opening, and there will be a session to allow other participants to ask questions. And I want to encourage each and every one of you to please listen to the experts who are going to tell us what the challenges are in the context of small countries and as far as the response to HIV and AIDS is concerned. So the experiences, challenges, and lessons learned in countries, the 3 countries that have been identified for that international panel are the Gambia, Guinea-Bissau, and Cape Verde. We will hear from the experts, and like I indicated earlier, the opportunity will be created for question and answers. So it's not only limited to the panelists, but as participants will be given the opportunity to also share what we think are our experiences. Some of us in the room here, or most of us in one way or the other, have played a part in the response to HIV and AIDS. I want to welcome you and wish you the very best in this very important segment of the Regional Steering Committee of the FAIF Impulse Project. Thank you.
Badji, merci beaucoup. Et nous allons donner la parole à M. Djegan Loum, qui prendra la parole. Et remercier déjà M. Badji Ousmane d'avoir bien voulu prononcer ces mots de bienvenue à l'ensemble des délégations venant de tous les pays du projet FAIF, à savoir le Cap-Vert, le Burkina, le Niger, la Guinée-Bissau, la Guinée-Conakry, le Sénégal, le Mali, que tous ces pays sont là aujourd'hui afin de partager leur expérience, leurs réflexions sur la lutte contre le VIH. Et nous rencontrons nos homologues et bien, pour encore, tout de suite après la cérémonie, faire encore des échanges. Donc, M. Djegan, si vous voulez bien ouvrir votre micro et aussi dire quelques mots aux participants. Merci.
Because now we don't say, network or, we say family because we are all one family now. As Michel have said, NASO has a membership of 8 countries. Which is being supported by Luxembourg Corporation. If you look at the theme, I think it's very important. Because the response in big demographies and in small demographies will not be the same. If you can see Gambia and Cape Verde has the smallest demographics. And that is why I think this panel, this international panel, is very, very, very important. If I can recollect, if I can remember, there has been about 10, 12 regional steering committee meetings. This international panel is an innovative one. This is the first time this type of panel is being organized. Because NASO joined the family during the implementation of Phase 2. And then we went through Phase 3. Now NASO is implementing Phase Impulse. Today, this morning, we made some site visits to the AF, Edward Francis Small Teaching Hospital, where NASO is supporting the cervical clinic, and the hepatitis B clinic. We had the remarks of the Chief Medical Officer and his top staff, who commended those initiatives. From there, the team proceeded to GFPA, Gambia Family Planning Association, where NASO has also rehabilitated the laboratory. So these are just, this is the final part of the regional meeting. With these few words, I just want to thank you all and welcome you to this international panel. I'm confident the panelists I'm seeing here, I know them very well. They are really experts in the field of HIV and AIDS and other related issues. Once again, let me give a warm welcome. I thank you all.
Madame Bissali, pour des questions logistiques, nous vous invitons à venir.
The UNAIDS Country Director, the President of NASO, distinguished participants, dear colleagues. On behalf of ENDA Santé and the FEV Impulse Network member organizations, I would like to extend to the host country, the Smiling Coast of Africa, our most sincere thanks for the welcome extended to all the delegations here present, but also for having agreed to host this international panel. We can end AIDS by 2030, but the curve will not bend itself. We have to pull it down together, said Winnie Bianima, Executive Director of UNAIDS, at a high-level side event on political leadership in the HIV response back in September 2022. We have to pull it down together, a joint effort necessary for an effective response to HIV and the central element of the FEV regional project that brings us together here today. The FEV Impulse Regional Project, also known as Borders and Vulnerabilities to HIV and AIDS, has been supported for more than 15 years by the government of the Grand Duchy of Luxembourg and coordinated at regional level by Enda Santé. It brings together partners from 8 countries of our West African sub-region, all present here today, including Burkina Faso, Cabo Verde, the Gambia, Guinea, Guinea-Bissau, Mali, Niger, and Senegal, around 2 strategic objectives. The first one, focusing on building a stronger and more resilient health ecosystem, including civil society organizations, as well as health facilities, and ensuring the quality of interventions in line with regional standards. The second one, focusing on service delivery for the most vulnerable to HIV by allowing access to screening, reducing their vulnerability to HIV, as well as improving access and retention in ART. Data from the last 2021 annual report of the FEV Impulse Regional Project indicates that close to 9,000 individuals benefited from HIV and AIDS prevention services. 7,000 individuals had access to HIV testing. Dear colleagues, dear participants, as I mentioned earlier, the FEV Impulse Regional Project is implemented across 8 countries. 8 countries which certainly have the West African sub-region in common, but which present different realities from each other in terms of intervention context, organization of the response to HIV, but also in terms of size. The curve will not bend itself. We have to pull it down together. But how will we achieve this? How are countries currently achieving this? What are some of the key elements contributing to their success? This is the objective of this international panel, which will provide us the opportunity to understand and learn from 3 countries' specificities. On behalf of all those involved in the response to HIV, and more broadly in health, I would like to thank the Luxembourg Corporation and the NGO SANAccess for the frank collaboration and for the trust that allow us year after year to offer a quality response to the needs expressed by the communities of our West African sub-region. I thank you for your kind attention.
Good afternoon to everyone. Mrs. Representative of the Director of Health Services of the Ministry of Health, Mr. Lum from Nassau, Mrs. Turpin from Enda Santé, Mr. Badjier, moderator of this panel, dear guests, I'm pleased to say a word on behalf of Luxembourg as part of the opening ceremony of the international panel organized together by Enda Santé and Nassau. I will be brief and will say a few words about Luxembourg's position on the global HIV response, which needs to be accelerated if we want to end AIDS as a public health threat and as the international community promised by 2030. The Grand Duchy of Luxembourg has been involved in the response to HIV for many years. Our cooperation strategy is fully aligned with the new UNAIDS Global Strategy to End AIDS. The fight against communicable diseases is in this sense one of the major priorities of the health component of Luxembourg's strategy to achieve the SDGs, the Sustainable Development Goals. At a time when external public aid funding is being decreasing, Luxembourg continues to maintain its level of official development assistance at around 1% of its gross national income, keeping international solidarity, particularly in public health issues, as high priority in its development strategy. Luxembourg engagement towards the HIV response remains strong in view of the fact that AIDS is not over. It is one of the deadliest pandemics of modern times. Evidence based on UNAIDS report shows that approximately 1.5 million new HIV infections were reached and 38.4 million people were living with HIV in 2021. It is therefore critical to maintain efforts unabated. I take this opportunity to thank FEVE network of organizations who are on the ground ensuring that a people-centered health services approach is being put in place to end AIDS. Luxembourg expresses its satisfaction towards the strong partnership with Enda Santé and through it, its FEVE network. This long-standing partnership, which is now translated through the financial support of FEVE Impulse project, envisions to contribute to the control of the HIV epidemic and the achievement of the Sustainable Development Goals in West Africa. The innovative approach of the project is not only based on a people-centered approach with key populations as an integral part of the HIV package of services being offered, but it also adopts an integrated approach on considering other chronic diseases as part of HIV services. It builds on South-South and triangular cooperation while also looking at sub-regional commonalities. This panel is a good example of such cross-border exchanges, with a discussion around cross-border experiences on HIV responses in small demographic context. The size of countries and the way those countries approach certain challenges can be conducive to piloting and testing certain solutions that can be scaled up and can become a model for the sub-region. Thus, I'm very interested of hearing about the perspectives of the Gambia, Cabo Verde, and Guinea-Bissau. Thank you so much for organizing this panel, and I very much look forward to the discussions. Thank you for your kind attention.
Mustafa Bité, Dr Fatimata, dire tout simplement que la mise en œuvre de ce projet requiert forcément une collaboration avec les gouvernements, donc avec tous les gouvernements respectifs des pays de mise en œuvre du projet. Nous avons énormément collaboré et ici en Gambie, à travers les démembrements de l'État comme NAS, nous collaborons toujours pour atteindre les objectifs du projet parce que nous savons que tout seuls nous ne pouvons rien faire et que la durabilité de nos actions requiert forcément l'engagement également du gouvernement. Et nous vous remercions, nous remercions le gouvernement de la Gambie pour l'appui et le soutien constant. Docteur Fatoumata. Rejoindre cette pupitre.
The Director of Enda Santé, representative of the Luxembourg Embassy, Executive Director of National Aid Secretariat, Program Manager of NASO, senior colleagues in the room, all protocols duly and respectfully observed. Good afternoon to you all. I am here representing the Ministry of Health, the Director of Health Services. As a ministry, we are aware that the HIV/AIDS pandemic continues to pose threats to ensuring the attainment of high standards of health for all. While significant progress has been made in combating HIV in the sub-region, our regions remain behind in comparison to other parts of the world due to different issues, and I assume everyone is aware of that. we continue to make efforts in not just fighting out the reasons, in not just figuring out the reasons behind such gaps and challenges, but the ministry continues to be committed to support and pioneer all programs and policies geared towards responding to HIV/AIDS. The ministry welcomes collective efforts such as the FEF Regional Project, which creates platforms and avenues to synchronize expertise, resources, services, and we believe that this will go a long way in helping us attain the universal goal of the ministry, which is to reduce the morbidity and mortality when it comes to HIV. So on behalf of the Ministry of Health and the staff, I would like to acknowledge the tremendous contributions and progress made under the auspices of FEF in combating HIV/AIDS in the Gambia. By extension, I also want to thank our different program areas that are working towards combating HIV/AIDS in the Gambia. I thank all their partners and all participants here. I wish you all a successful deliberation. And on behalf of the Ministry of Health, Director of Health Services, and on my own behalf, I declare this meeting officially open. Thank you.
Permettre aux journalistes de poser des questions et de revenir certainement sur de plus amples détails avec les différents intervenants. Donc, nous allons vous permettre, nos collègues vont vous inviter, ils ont déjà préparé une place pour la conférence de presse. Donc, pour les autres participants, nous restons en place. Ça prendra à peine 15 minutes, le temps de préparer pour les panélistes. Le panel de haut niveau sera animé et modéré par M. Ousmane Badji et connaîtra les interventions d'experts du Cap-Vert et de la Guinée-Bissau.
One of the major challenges confronting the response to HIV and AIDS, and this is not limited to Gambia, this is a global challenge. You go to any country, even the most developed countries, they continue to grapple with issues relating to stigma and discrimination. And so there are efforts. Countries have started to invest in research relating to stigma and discrimination. So the conduct of stigma reduction strategies with support from partners like the UNAIDS is one key strategy that is geared towards coming up with interventions that would be helpful in terms of reducing. So when you do an index study, you in essence trying to find out the reasons behind the behavior and social injustice meted against the community of people living with HIV and AIDS, and you try to ensure that during your programming you provide interventions that are geared towards addressing those particular issues. So one thing we do is to intensify sensitization among the general population, but even among healthcare providers, because evidence is showing that stigma exists almost at all levels. So you have stigma and discrimination at the household level, you have stigma at workplaces, you have stigma at community level, but you also have stigma at healthcare settings where these people are supposed to access services. So you tailor your interventions depending on the level that you want to address as far as those issues relating to stigma and discrimination are concerned. So in essence, we collaborate with partners to provide investment to see how sensitization can be stepped up, because a lot of the issues around stigma and discrimination are due to the fact that people are ignorant. Because some people have the misconception that a handshake with somebody living with HIV can give you HIV. People think that when you buy food from someone who is living with HIV and AIDS, that is another mode of transmission for HIV. People think that sitting in the same room with somebody who is living with HIV can be a way of, so it's the myths and misconceptions that we're trying to address in our HIV programming to address stigma and discrimination. But it is still a major challenge. Thank you.
Can you hear me?
Yes.
A question. It is true that we have noticed that in our region, results are not as high as we would have expected them to be. What we need to understand is that we are in a very challenging region. We are in a region that, in terms of challenges, we are confronted to different conflicts. You know that in our region we have quite a lot of issues related, for example, to terrorism. We have a lot of priority areas that need to be addressed in our countries and that are not as high in terms of political agenda when it comes to solving some of those issues. This is why we are happy to mention that last year we were able to organize a high-level political summit in Dakar, Senegal, just to make sure that in all our region, countries are sufficiently aware of the death toll when it comes to AIDS-related issues in our continent, and are also able to identify what should be the key element of our responses. This has led us to solidified partnerships, but this has also led to the identification of key partners that are now making the effort to contribute more to the response to HIV in our region. You mentioned it well when you read the information that is mentioned in the terms of reference. But what I also would like to emphasize is that we have noticed that in our region we are making good progress. The progress is not to up of our expectations, but we are, compared to the other regions, we are making quite good progress in terms of addressing HIV-related issues in this region.
Thank you for that question. As a ministry, we're trying to make sure that we improve on our HIV services, and that is why we have the National AIDS Secretariat and the National AIDS Control Program. We have program areas that are focusing just on HIV and other and its related issues. So they are very competent staff who are making sure that HIV care is not left behind in the Gambia.
Assistant Director of Health Services indicated, the program provides support in relation to the different components of the HIV response. And currently we have over 8,500 people receiving treatment relating to HIV and AIDS. And this is not a small number. These are people who are expected to take treatment services on a daily basis. So this is made possible through the support of partners, of course, and the Ministry of Health and the government of the Gambia. So apart from the sensitization, we are providing treatment services, and the people who are providing services are staff of the Ministry of Health. Government, since 1986, when the first case was diagnosed in Gambia, has come up with policy direction in terms of where we think the national response to HIV and AIDS should be. So through those policy and strategic plans, we are coordinating with partners, and this is not only the Ministry of Health. You will realize that within the civil society sectors, there are very key and central players like ActionAid International, the Gambia, who are also providing investment and coordination relating to the response to HIV and AIDS. So yes, sensitization, treatment services, and a host of other interventions by government are all geared towards addressing issues relating to HIV and AIDS in the Gambia. So it's not only limited to HIV. Government is providing the enabling environment. You will notice that initially there were a lot of legal barriers relating to the response to HIV and AIDS. But since the change of this political administration in Gambia, there has been some kind of recognition and action has been taken in terms of improving the legal environment. So that is also the role of government and the civil society, with the advocacy part being played by the civil society organization. Thank you.
To come back to what we provide as support related to the HIV response, as I mentioned in my opening remarks, this is part of strong engagement of Luxembourg as part of the health strategy. So we support Enda Santé, and through Enda Santé we also support the network of organizations that partner with Enda Santé on the response to HIV. But beyond the support that we provide to civil society specifically on HIV response, but beyond as well on HIV, we do have also support that's encapsulated, for example, vocational training, issues related with creation of employment. So we do have also a line of support that goes on these related elements beyond the health aspect and specifically on HIV. But we do work a lot on as well to stick on the health aspect and working also with Enda Santé. We do also support, for example, young women to go beyond violence-related aspects. So we do have specific elements that,
If you want to receive monies from UK, Europe, USA, Canada, Switzerland, and the rest of the world, Supersonic's money transfer has got you covered. With the largest payout network in the Gambia, you can now receive your monies anywhere you are, from Kartong to Koina, with less hassle. Yes! You can receive monies from your family and friends in UK, Europe, USA, Canada, Switzerland, and the rest of the world with our safe, secure, fast, and convenient service that offers you the largest selection of payout locations in the Gambia. Supersonic's money transfer. We are currently in 34 African countries and counting, giving you quality money remittance services that are second to none. Visit the Google Play Store or the Apple Store today to download the Supersonics Money Transfer app and enjoy excellent money transfer services only with Supersonics.
And we having businessmen not to complain. Ila kulun kanale fu banjo. Ibuka jino ebuka la bagaso jin. They turn back. They katafen gold drop into Senegal. Gambia bagaso kajisena. Omasi bolet.
Dr. Ture contributed immensely to the failure of Adam Barrow regime from 2017 to 2020.
Manke mola foye ko babun wok monkey it bar committee la jero yaje ko wala be tamakan NPP kono.
Yes, ngajale because ya ken defangola I was victimized. Who? The party executive. President ya bulobula among intervene because atele sonta yenna the political campaign.
Baro e muno famone ning arta hanarta komen ko be jaralale. We transport people from Mali, Sierra Leone and other countries, but we are going to do it. Pour kamol transport ni nalana can support for 5 years on moesia proud.
Bari ita fono la ko ha minister la jodo atale ngadinga minister tal allowance la fa mol membe duma. Minister patata nyaonya mol membe marché auto jendan jaay o famasol do Sénégal membe bolon kono wolle patata minister ti. Kotonte balafa no la minister e ka fo minister la jodo atale nga balafa wanto director la jodo atale nga balafa.
Yaya has the political power. Yaya has the political popularity in the Gambia. Hanebi molbe lafringalale anu hanebi ala yamaro na futa molka.
Let it be put straight that marriage should be between a man and a woman only if they reach the age of 18 and above, or if they reach maturity, because people could be matured before they reach 18.
So every year, the GFF receives $1 million from FIFA, $500,000 in January, and another $500,000 in July.